Patricia Nicole Hanato, and I am back at my favorite aesthetic clinic at CSA Medical Aesthetic. And I am here now to treat my acne scars. Previously, I did the Perfect V, which really contoured my face, and as you can see, it really changed. Before I had a round face, now I really saw the difference in my face, and now I'm back here to treat my acne scars. So before, I don't have any problems with my acne scars, but when I started reviewing for my board exam, I really got stressed, and I was stress eating, and it was showing on my skin. My acne was showing up, and then now I have a problem with the scars, and now I'm here to do the microneedling and the air shine to resolve my problem. And don't forget to like, share, and subscribe.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, let's talk about microneedling. But before that, let's welcome back Patricia Nicole.
Hi everyone, I'm back at my favorite aesthetic clinic here at CSA.
Thank you, Patricia. Dr. Patricia Nicole. Okay, in the previous episode, we've done a so-called Perfect V treatment for Patricia, whereby we did some contouring or reshaping of the face, narrowing it. Okay, we had the ulcera, we had the chin, and I think we did also some injections here. Now, we wanted to treat the so-called acne marks, because during that episode, Dr. Patricia had some of the acne. Remember, we had that shoot, and you had some active pimples during that time. Yeah. And the concern now is those pimple marks. Okay, the souvenirs from your acne. Okay, they left some marks there. And also others are concerned about how to treat those large or dilated pores, how to make their skin very well regenerated, healthy looking, radiant, glowing all the time, or as if like there's no pores, or always smooth and always fresh looking. As if like I woke up like this.
Yes.
That's the trend right now, yeah. Okay, we have this topic, Dr. Patricia, the so-called microneedling. Well, way back like 2008, 2009, I was doing the so-called Derma roller needling, or the collagen induction type, whereby we induce like micro injury into the skin, like those tiny needles. Have you heard about those derma rollers,
Yes, no.
derma stamping, or those derma pen?
Yes.
They have needles on the tip of those devices, right? And you wanted to like make micro injuries in the layers of the skin, like epidermal layer. For doctors, we reach about superficial dermal layer. We wanted to reach the fibroblast tissue cells, and we wanted to induce collagen formation and elastin regeneration so that we can somehow build new tissue matrix to lift those dented acne scars, right? That was the mechanism of action. Now, right now, we are in the generation of laser technology. So, in this generation, since we are already advanced in our aesthetic treatments, we also have the RF microneedling or laser microneedling. So, we have different brands. We have Infini, Ensemble, Genius, even the Vivace. So, they have microneedles, but at the tip of the needle, they emit laser energy, laser pulses already. So, they have combined those laser and the needling, okay? But right now, here at CSA, we have another type of microneedling technology whereby we use the so-called micronutrients or the so-called skin boosters. Have you heard of that, Dr. Patricia?
Not yet.
Not yet, right? Because since we have these acne marks, or some have this depressed acne scars. So we wanted to somehow regenerate the tissues from within. We wanted to, of course, separate the scar from the skin. So we have the technology, the so-called air dissection. So once we enter like the tip of that needle and then have the air dissect the epidermal layer, somehow you're separating the acne from the skin, or the acne scar rather, the scar from the skin. So once you separate it, now you have a space there. So what do we do with that space there? We have the air shine technology, whereby we deliver beneath that scar micronutrients, skin boosters, amino acids, peptides, or even growth factor peptides, or even cytokines, vitamins, minerals, or all those essential micronutrients for the skin to regenerate, for the skin to build new collagen, new elastin, new tissue matrix. So it's healing from within, it's repairing from within, so that when you build those new fibrous materials or protein tissues, you're able to lift that sunken scar. Make sense?
Yes, Doc.
So something that will regenerate from within, but the effect is seen on the outside, and something that will last already forever. Because once you treat that sunken scar and you had build up those new protein materials or tissue matrix, so naglift na yun eh. So even na siya sa surface. Unless you get new acne again. Of course, you also have to prevent acne. You have to control sebum. You have to control formation of those new pimples, okay? It's also a matter of lifestyle. So in the past, we've been talking about pimple problems, what are the causes, and how do we treat them. So today, it's more of how do we manage the acne marks, the scars, using microneedling technology with the infusion of our skin boosters. So ating abangan ang actual procedures sa pagbabalik ng CSA Medical Aesthetics. And we're back. So we're doing the so-called treatment, microneedling for Patricia, and looking at her face, her skin. So on the forehead region, I noticed there's this linear scar here, and Patricia told me that during grade school time when they were playing, like she hit her head on the ground, causing this mark here on the forehead region. So we will also treat that. And looking at the mid-face section, so we have pimple marks, blemishes, and some tiny pitted marks. Okay, and then also we wanted the pores to somehow be minimized, reduce the size of the pores, and then lower third of the face also pimple marks. So we wanted to do a treatment that will somehow repair the acne marks from within. And there's also some redness. We wanted to apply a skin booster that will calm the redness, a skin booster that is anti-inflammatory, anti-redness, and antioxidant as well. Okay, and somehow help in the management of the acne conditions also. Okay, so I'll be starting with my device here, the so-called Air Shine, Ultra V Air Shine, and I have the air dissection device. So again, we're infusing air into the epidermis, very superficial epidermal layer. We wanted to separate the scar from the deeper layer of our skin tissue. So I'll start with the upper part. So we have this diagonal scar here. So I have my foot pedal here, and then just the very tip of our gauge 13 needle into that skin layer there, and then inflate a little bit. Okay, so that is to separate the upper layer of the scar. Okay, so I just needed my assistant to press on the brow region. Okay, just the tip of our needle, the bevel tip, and going like that. Okay, there you go. So there's a noticeable elevation already. Okay, and I need to press on this. Okay, just to separate the scar from the deeper layer. Okay, so now I can proceed to the mid-face section. You're okay, Doctora?
Yes, Doc.
Okay, so mid-face section, I wanna improve the skin texture here. I wanna tighten the skin, close pores, or shrink the pores. So I'm just gonna work on doing this part here. Okay, just a tiny blanch, which is expected. So Dr. Patricia was able to treat her active pimple. So some tiny blanching there, and then let's go to the left side there. So we wanted to treat the acne marks. So this is a simple, easy technique. And we are already improving the skin layer, the surface layer. Okay, there you go. I also use this kind of air dissector for those with deep wrinkles or furrows of the skin, or also for like the glabellar, rather the nasolabial fold here. So let me just show you. For example, you have a deep line here. We can get rid of that deep nasolabial crease there by doing this simple technique. So for some of my patients with deep creases on their forehead, we can use this device also. Or even for the skin of the nose, for those with wide open pores on the skin of the nose, we can use this device too. Like a simple technique like that. So just infusing this air dissector and improve the skin on the tip of the nose. Okay, so now let's proceed to the microneedling part, making use of our Ultra V Air Shine. So I have here some solutions of our skin boosters. I will be mixing different kinds of skin boosters. Right now in Korea, they have several types of skin boosters. They have the first generation, second generation, third generation, and fourth generation. And here at CSA, we have all those 4 generations of the skin boosters. In the first generation, they started with the vitamins, minerals, and hyaluronic. Second generation, they incorporated the so-called polydeoxyribonucleic. The third generation, they have the exosome, like the growth factors or stem cells. Now, the fourth generation is the so-called ultra-col type of skin booster. So for now, I'll be using for Dr. Patricia something that will improve the acne marks or acne scars. So specifically, the Celetox is to improve those acne scars. And I'll also help in rehydrating the skin with my Derma booster. And then also a combination with multiple vitamins and minerals. So 1 cc of each, and I will just mix them with my device here, a mixer device here. So it's easy to perform this. Just like with our Radis biostimulant, we use this for the mixing of that one. Mixture of our skin boosters. Okay, the skin boosters, they have hyaluronic, amino acids, growth factors like those EGF or those growth factors for the skin that will help improve the microcirculation, or something like polypeptides or oligopeptides or decapeptides, all those protein materials that will help in regenerate our skin and repair the skin. And we just wanted to help the skin regain its natural radiance, glow. So from within, you wanna hydrate it, and you wanna promote skin collagen renewal for skin tightening, firming, lifting, and also tighten those open pores. And they contain antioxidants like our vitamins, like for example your vitamin C, and they have this glutathione to promote skin brightening. And we also have the idebenone for skin brightening. So it's indicated for all skin types. It's gonna improve your skin tone. It's gonna create collagen formation, elastin formation. It's gonna do revitalization. It's gonna regenerate. it's gonna repair from within. So anti-aging, for brightening, cell rehydration, all of those benefits. So we will be using our air shine. So the air shine has this handpiece here. We connect this cc or syringe, like about 5 cc syringe here. We already have all those skin boosters, all those micronutrients. Okay, so initially I'll work on the forehead region. So I'll just connect the tip of this. Okay, there's like a vacuuming effect of this one, and then I'll do my first shot. Okay. And then second shot. How's that? So it has micro needles. It has 9 pins, and then the moment I press on this button here, then the pins will go into the epidermal layer. It depends on what will be how many millimeter of the needle will I use. It can even reach the superficial dermis or the so-called papillary dermis, so that we can deliver these micronutrients into that dermal layer. So we can tap the fibroblast to make your new collagen, elastin, and other important tissue matrix. Okay, so I'll just continue doing that. And then shot. Okay, how was it, Doctora? She's good. So it's easy to perform. It's safe. So this one is different from our RF microneedling. That device has a laser energy pulse delivered at the tip of those microneedles. But this one, the advantage of this one is we are infusing in the dermis all those significant micronutrients, those stem cells or peptides, growth factors that our skin will need in repairing and regenerating. So if you want to treat those acne scars, you want to treat deep wrinkles, you want to rehydrate your skin, boost your skin, or even those pigmentations, problems with melasma, post-inflammatory hyperpigmentation, or even those with concerns of large open pores, this is a very good alternative treatment to those laser devices. Some people are reacting to the laser energy by creating more pigmentation. So for those with contraindications on laser devices, we can make use of this microneedling Ultra V Air Shine. So you're already delivering significant micronutrients into the inner layer of your skin. So we actually have mesotherapy. This is an alternate treatment for meso injections. Instead of doing your individual injections, you can make use of these microneedles to deliver those important solutions into the skin. Like for example, I have the mycotoxin meso injection. I can also use this for the delivery of my baby toxins, baby tox or the baby botox, or even my dermal filler hyaluronic, non-cross-link hyaluronic. I can use that as my solution for this microneedling, or even those copper peptides and other amino acids. This will be the best alternative to that. It's like a meso gun. So you're already delivering important solutions for the treatment of the skin concerns you may have. And usually we recommend repeat of these, like for this type, 2 to 4 weeks will be fine. Then actually after this, I will combine the so-called microneedling with the roller type. Then I can also work on the nasal region. Sorry, Doctora, I want to improve the skin here on the nasal tip. So for those with concerns on the skin on the tip of their nose, large pores, or concerns with acne marks also, we can use this kind of device already. Okay, so there's a suctioning effect there. We just need to maneuver the tip of the nose here. So we just have to somehow give that suctioning effect. Sorry, Doctora. Okay, because this one is a flat area here. And then I can just press on this side so that I can suction it better. Okay, there you go. So we're done with the Ultra V Air Shine. And we still have another demo of a procedure. We'll show that when CSA Medical Aesthetics return. Okay, so we're continuing with our treatment for Dr. Patricia. So we did a while ago air dissection with the Ultra V Air Shine. And right now, we'll be infusing with more micronutrients via using our microneedle derma roller type. So we have here this device here, and it's covered. And actually, I'll just connect it with this vial of our, like this is Oriole Skin Boosters. The Oriole Skin Boosters contain hyaluronic, amino acids, vitamins, minerals, growth factor, peptides, revitalizing peptides, and growth factors. So I'll just attach this to the upper portion of this vial. So it's just a clicking like that, and then remove the cover. So it has microneedles also, and it's a roller type. Okay, usually the professional or medical derma roller types that we use in our clinics, they have like a needle, microneedles with like a 1.5, 2, or 3 millimeter depth. But for home use, you can have the 0.25 to 0.5. So meaning to say they're just at the epidermal layer only. But for medical doctors, we can use those deeper, or rather those microneedles that are longer. Okay, again, for at home use, 0.25 to 0.5 only. So this one, so it has already inside the vial the solution. So what I will do, I will start on the forehead region of Dr. Patricia, and I will just be rolling this, just like our old technique before, the derma roller, but this one has already skin boosters in it. So Doctora, I'll be touching the forehead area and work on the, like you have a scar on the forehead here. So just initially I'll work on the scar region, and I'll just glide it like that, roll it like that. Okay, so ideally I can already, there you go, put a drop of our skin booster solution and roll again. So the rolling can be horizontal like this, horizontal like that, this one, and then vertical like this. So like tic-tac-toe, or your cross-hatching. So I can continue with the other sides. Okay, just a gentle roller. So take note, our main focus was this scar on the forehead. Now we also have acne marks here. Again, I can do that same cross-hatching technique. Sorry, Doctora, you feel the needle, but it's okay. Okay, so vertical, rather horizontal, and then vertical. Okay, so we're done with our needling using the roller type of tip, and we have used our Oriole Skin Boosters. Okay, we'll show the result to Dr. Patricia when CSA Medical Aesthetics return. And we're back. We'll now show the result to Dr. Patricia. Doctora, here's the mirror. Okay, so we have done the combination of air dissection, Ultra V Air Shine with infusion of our Derma Booster Celetox Boosters, as well as that microneedling using the Derma Roller type. and we had used the oral skin boosters to infuse those essential micronutrients. So, Doctora, how was the treatment?
Doc, I always say this to Doc that I have a very low pain tolerance, but with the procedure, it was really tolerable, it was quick, and especially with Doc, sobrang gaan ng hands niya, and
Thank you,
okay
Doctora.
Okay lang, ang galing ng
Yeah,
procedure.
so meaning to say, even though we use some microneedles there, it's a tolerable treatment, right?
Yes, Doc.
Although before the procedure, we did apply the topical numbing cream, okay, somehow to reduce any discomfort there, okay? So we had the lidocaine topical cream. We left it for about 45 minutes. And then so initially, we will expect some redness on the skin or erythema, and it's very temporary. Usually it's just like a day or two, and then it's gonna go away already. And then since we had microneedles there, a while ago we had this cryotherapy, cold therapy, so that we can somehow make those tiny marks or injection marks go away quickly, so that like if you have an event the following day, because you might have like work or something to do and you need to put on some makeup already, you can already put on your makeup. Okay, so after this, we will advise you, okay, to put on sun protection. It's very significant. We have our sunblock all the time. And then anti-redness, we can make use of some of our gentle creams only, so something to calm the skin. So we have here some of our like anti-redness cream that we can share with you also, that you can apply at home. Okay, and then do not have hot shower yet.
Yes.
Okay, and so with this kind of treatment, somehow we expect result in a week or two. Since we infuse those micronutrients, we give time for them to take effect, and then we repeat it. Like for example, those microneedles with the Derma roller, you can do it every 2 weeks for 3 sessions. And then after the 3 sessions, once a month for 2 sessions only. And case-to-case basis, the others will need more sessions, others will need fewer sessions. With the Ultra B Air Shine, we can do it after a month again. Okay, so for those people asking me, when do you repeat it? Okay, so this is a very good treatment, a safe treatment for all those who have concerns of acne marks, acne scars, even those wrinkles, lines, or sagginess, or those with melasma, because we also have skin booster for melasma using our idebenone, niacinamide, and other whitening components. Thank you, Doctora.
Thank you so much, Doc. It's always an honor to be here, and then I can't wait to see the results.
Yeah. So we'll do a follow-up for Doctora. And actually, I was asking you, Doctora, a while ago, the hyco treatment we did last time, I think it's been a year already. So next time we'll do the so-called hyco booster. Since we're talking about skin boosters here, let's also do a hyco booster next time for Doctora.
There's a vaccine booster. There's
Yeah.
also a
Hyco booster. Okay, thank you, Doctora. Thank you so much.
Doc.
If you have any questions, you may email us at csaskinclinic@yahoo.com. We have our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Malagul, Angeles City, and our contact number is 0933-860-9193, 0917-504-4268. So thank you so much. Please do watch our other episodes. We have them at our YouTube channel, Contessa Salvador. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.